everyone, and welcome to KSAU Master Talk. Today, it's our honor to have our distinguished guest, Dr. Sandro Rocha. Dr. Sandro, he is a professor in the Department of Pharmaceutical in Virginia Commonwealth University. He is a key member of the Massey Comprehensive Cancer Center. Dr. Sandro, internationally recognized for his pioneering work in nanomedicine and lung cancer treated. And also, he is the founder of PhD program in pharmaceutical engineering, the first of its kind in CVU, and I think it's also in the world. A program that bridging pharmaceutical science and engineering to drive innovation in healthcare. Welcome, Dr. Sandro, and thank you for accepting our invitation.
Thank you. It's my great pleasure and honor to be here.
Thank you very much. Dr. Sandro, your career has beautifully merged two different aspects, engineering and pharmaceutical. How this initiative came to your mind? How did you start it? And how you did it?
So this VCU happens in a very organic manner, organic way. So we had faculty from the School of Pharmacy in the Department of Pharmaceutics that had a long-standing collaboration with people in engineering, particularly mechanical engineering at VCU. So pharmaceutical engineering was actually being done at VCU for a very long time. They were very successful in developing their programs. And when I joined VCU in 2015, this idea was basically just putting that into practice in terms of a program, an educational program. So the idea was already cemented through that collaboration, initial collaboration. And our task was basically creating this new program that would educate the students, the next generation in this area.
So you created that program in CVU.
Yes.
What's and it's I read about it. It is the one of the kind in the world. How did you drive this? What type of collaboration you needed, not only on academic level?
Just like research, which is team science, to be able to come up with a program like this is also a team effort. And it is a collaboration from folks that have a strong foundation in the pharmaceutical side with people with strong foundation in the engineering side. I am an engineer by training. And so, of course, for me, that was very exciting because my research is in pharmaceuticals. So I have always had this dream of coming up with an educational program that combined the two, and having VCU giving me the opportunity to actually work in this program was just fantastic. I could be happier to be able to engage into that.
Yeah, it is amazing program. The two words together, I barely heard them all over the world.
Yes.
So bring those two worlds and getting a graduate that's filling the gap in the market, that's amazing initiative.
And I think this is a really important point of filling the gap, right? Because in the pharmaceutical industry, people are doing this every day. They have been doing this every day, the pharmaceutical engineering. What we didn't have was a formal program to train the students so that they can perhaps more quickly be up and running and doing what they are expected to be doing. And I think this was a big driver for us to come up with the idea of the academic side of this program, and putting the curriculum together is really being able to provide the students with this continuum of knowledge from target identification to clinical trials, all the way through API synthesis and manufacturing.
Yeah, such a program, it's amazing. I think you're preparing a talent instead of training. You're preparing them from scratch to go and drive the innovation, drive the pharmaceutical companies. And that's something, a lot of programs are good, but not all of them targeted an important gap in the market. So it is amazing what you did. And I'm sure this is one of your proudest achievements in life.
Absolutely. Thank you. And, when we think about, especially as you start getting older, you think about your legacy. I think this is really a terrific opportunity. And as I was saying to you before, that the research that you do today, a year from now, it's old news already. But when you can impact the community by developing new programs, this is a long-lasting legacy. And I couldn't be happier that VCU gave me this opportunity to be able to take time away from other obligations to put together such a program. And this particularly graduating the students. So we have gone through the whole cycle from ideation of the program, designing the curriculum, approving at the university and state level, implementing the program.
This is a lot of work.
It's a lot of, but very rewarding work, especially when you get to see students defend their thesis or dissertation in this case, and move on to successful jobs, which we did this last year, the first ever PhD in pharmaceutical engineering graduate.
About your first cohort graduating.
Yes. So
how was the feeling?
Well, so it was interesting because the first group of students that we brought in was during COVID. So it was just like crazy time to be starting something new like this, right? Because we needed to do everything was Zoom and trying to connect with people that way, recruiting people that way, interviewing people, bringing on board, right, students during that time.
It didn't stop you.
It
did not stop you.
No, it did not stop us.
I'm
just as motivated.
impressed.
Thank you. Yeah, it's exciting.
Back to your nanomedicine, lung cancer metastasis, your scientific focus. Tell us more about it. What dragged you there?
All right. Yeah. So I'm a chemical engineering by training, as you mentioned before. And that's how I started my career 23 years ago as a professor in academia. Soon after I started, my dad was diagnosed with lung cancer. And I felt like, with what I had, I needed to contribute somehow. And I quickly shifted all my research towards that and developing into what we do today, which is trying to come up with new strategies to treat cancers in the lungs, both primary and metastatic cancers that go into the lung, using this combination of immunochemotherapies and local lung delivery, using these concepts of pulmonary biopharmaceutics, and then using nanotechnology to be able to achieve all those, the ability to actually get the drugs into the target and develop safe and more efficacious therapies. So
See, all this sounds amazing. We're all excited about developing new drug. Translation those drugs from the lab to the clinical site. This is very challenging. What's the key, let's say, the key lessons you have learned from your experience?
Yeah, so I think this is a really interesting question because it bridges the science with the educational programs, right? So, science is a team effort, right? So there's no science that is not a team science, and my idea was always to engage with people that do have this very diverse thought, so right, diverse backgrounds, and going back to pharmaceutical engineering program a little bit. That was really a motivator to the way that we put the curriculum together. It was just so that we could attract the students from all sorts of backgrounds, not only engineering or pharmacy, but truly all backgrounds. And if you look at the composition of our group of students now, which we have about 25 students in our program, PhD program, you see that diverse background in there. And this is essential for you to push forward science in this area. Now, in terms of the translation, I think one very important aspect that comes from this different in thought process is I can see myself as an engineer doing this work in developing new cancer therapies. And then you look at how do I bring this into mass population later on. And this idea of being able to manufacture these therapies is, of course, critical, right? So when we are at the bench scale doing the preclinical studies, developing these technologies that can actually be translated later on For example, we do quite a bit of continuous manufacturing of these nanomedicines, even at the bench scale, so that we can accelerate translation. This is very critical. And this, I think this can only happen when you merge all these different backgrounds, right?
Sure.
Because, coming from an engineering side, this is very important to me, even though I am working with tumor immunology, this in vitro model, in vivo models with our team. So I think that, again, diverse of thought, diverse ideas, and bringing people from various backgrounds, this is essential for developing and innovating in this area.
Totally. Finally, I don't want to spend a long time. I know it's been a busy day for you. For our young scientists, for our freshly graduate, or recently will be a graduate, what's your advice to them?
Follow your dreams. I dreamed of being in this position since early on in my college life, and I just kept pushing it. So follow your dreams. Do something that you're passionate about. Going to work every Monday morning, you need that passion, right? Or when your stuff doesn't work in the lab, you have to keep at it, and you can only do that if you're passionate about this.
Exactly.
So be passionate about the work that you're doing, and I think those are the two messages for the students. Just be passionate, follow your dreams, and you'll get there.
Thank you very much, Dr. Sandro, for sharing your insight, your amazing story, your amazing program. It is really inspiring. Thank you for being with us here in KSAU for the last few days. We enjoyed and we had a lot of very valuable information from your side. Thank you very much.
Thank you so much. It's been a pleasure and an honor to be here.
And for our listener, thank you for joining us in KSAU Master Talk. Stay tuned for more inspiring conversation.